Standardized assessments continue to play an important role in evaluation, yet they have serious limitations when used with culturally and linguistically diverse students. What are some of those limitations, and how can clinicians supplement standardized testing to make more equitable diagnostic decisions?
So first, there's a difference between standardized and norm reference tests. Any task administered with a clear protocol is standardized. A norm reference test can provide useful information, but many were normed on populations that do not adequately reflect the linguistic diversity present in today's schools. So as a result, multilingual learners may obtain scores that underestimate their actual language abilities because the assessment measures conformity to mainstream language patterns rather than underlying linguistic competence. Another limitation is that norm reference tests often capture performance at a single time point and in a highly structured context. They may not reveal how students use language in authentic communication settings or how readily they learn when provided support. To make more equitable decisions, I think clinicians would need to supplement norm reference testing with multiple sources of data. This can include language sample analysis, dynamic assessment, parent and teacher interviews, educational history, and observations of the students across contexts. I'm particularly interested in approaches that examine language performance from a strengths-based perspective and allow us to see what children can do rather than simply documenting what they cannot do or are choosing not to do. So no single assessment should determine eligibility. The most accurate decisions emerge when clinicians integrate data from formal and informal assessments while considering a child's cultural, linguistic, and educational experiences.